Welcome and hello. I am Diane Landusky. I am a nurse with the Beaumont Health System, and welcome to the Blood Pressure Know Your Numbers, What Your Numbers Mean. I have worked with Beaumont for the past 25 years, and for the past 15 years have worked through the Beaumont Family Medicine Center and side by side with Beaumont physicians. What's been very interesting is almost all patients who come into the center have their blood pressure taken as part of the 4 vital signs, the other 3 being temperature, pulse, and respiration. Blood pressure is one of the major diagnoses used at almost all patient visits. About 1 out of every 5 patients have at least some issues with blood pressure. It is also one of the normal gauges that are used to see what overall health is within the patient's realm of health and lifestyle. So what is blood pressure? Blood pressure is the force of blood pressing against the walls of the arteries. When it's too high, the heart's workload can cause serious damage to vital organs and the arteries. It's written as 2 numbers, such as 112/78. The top number is called the systolic number. It is the measure of the pressure experienced when the heart beats. The bottom number, or diastolic number, is called diastolic. It's when the heart is at rest, in between the beats. So if you're taking your pulse during this time, the thump you feel is the systolic pressure. In between the beats is your diastolic. A good blood pressure is normally 120 milligrams of mercury, or millimeters of mercury, over 80 millimeters of mercury on the diastolic side. So the American Heart Association recommends the following categories for blood pressure readings. Again, 90/60 is considered the low part of the range. So anything between 90/60 to 120/80 is considered to be in the normal range. Pre-hypertension is 120 to 139/80 to 89. This is usually indicative of a possibility of actually creating a hypertensive state in the future if you don't make lifestyle changes. It's usually a good predictor. High blood pressure normally is written as 140/90 or higher. And once you reach the stage of 180/110 or higher than that, it's considered hypertensive crisis. Most often when you see somebody who has hypertensive crisis, who has blood pressures that high, they are actually symptomatic at that time. The symptoms can include severe headache, anxiety, nosebleeds, feeling short of breath. Any one or all of those things might be indicative of high blood pressure or a hypertensive crisis. In most people, systolic blood pressure number rises due to increasing stiffness of arteries, and that is part of the cause of high blood pressure at times. Which number is more important is often a question that we are asked. I'm going to start this one over too. So which number is most important, systolic or diastolic number? Both numbers are important. That's why healthcare workers actually monitor both numbers. Both systolic and diastolic numbers are indicative of high blood pressure if above the range that's expected. Typically, more attention, though, is given to the top number, the systolic number, as a major risk factor of cardiovascular disease for people over the age of 50 years of age. Arteries often become less elastic as people age, making them more rigid, which causes an increased pressure when the heart pushes blood through the body. So if blood pressure readings are above 120/80 or below 90/60, you might want to start checking your blood pressure at home. To check your blood pressure at home, you would need equipment of your own, So often I'll show you a couple different types of blood pressure cuffs and different ways to read your blood pressure. This is one way. This is a blood pressure cuff that has a dial on it. In order to use this type of a system, if it's not an automatic cuff, you will need also a stethoscope to go with it. This is also difficult at times to manage on your own. Sometimes you would need another person to help you with that. One of the issues with taking your blood pressure is if the cuff is too small for you, it is very difficult to get an accurate reading. The smaller it is, you might get a large, you might have a difficult time having an accurate reading because the blood pressure itself will range high even if it's within normal limits, but it's because of the cuff. So you need something that for sure is accurate. This one with the dial, in order to take the blood pressure, you would put the blood pressure cuff on your arm, and there is always something that shows where the artery goes. The artery is the brachial artery that you measure. That is right in this area here. So when you put the cuff on, you need to have this over the brachial artery. The cuff itself, in order to fit properly, needs to have some overlap of the Velcro. If it does not, then it starts to slip and it causes an issue. Another thing with this type of cuff, when you pump it up, you have to have this valve closed on the bulb. When you open the valve, you open it very slowly and the pressure will start to decrease. In order to read this, you have a stethoscope on with a stethoscope diaphragm on your brachial artery, and what will happen is you will hear a beat when you get low enough, and that first beat is the systolic pressure that you're measuring. You'll continue to listen, and then when you hear the last beat, where the gauge shows, that is your diastolic pressure, and that then is your two numbers that you would need for an accurate blood pressure. There's this type of cuff. I have another picture of a cuff on this slide here. That is an automatic blood pressure cuff that also fits on your arm. There are also cuffs similar to this that can be used. These cuffs can fit on your wrist and are easy to maneuver. Whatever you use, please make sure that you follow the directions from the cuff manufacturer and that you actually sit very still. Anytime you have movement during the time blood pressure is taken, often the automatic blood pressure cuffs will read that muscle movement as an actual pressure, and so that might throw your readings off. Whichever system you do decide that you need to use, that system has to have to be accurate for sure, because you would like to probably log those blood pressures. So the recommendation is to bring the blood pressure monitoring kit that you have into the physician office, and the physician then can have his staff measure your blood pressure with their equipment, then use your equipment and compare the two to make sure that your equipment is accurate and can be used for home monitoring. So, first thing I'd like to talk about is actually low blood pressure. Low blood pressure itself is usually not serious. It's usually not a problem. Actually, often people who experience low blood pressure are much more fit and have been exercising regularly. There is a time, though, when low blood pressure does cause a problem. It's usually in the elderly patients, where it may cause inadequate blood flow to the heart and to the brain and to other vital organs. The causes of low blood pressure often are getting up quickly from a lying or a sitting position to a standing position. It can be standing for a long period of time with your legs locked or your legs straight. It can be with dehydration or not drinking enough fluids. Often you'll see low blood pressure when there's some type of a trauma, shock, some type of major bleeding or burns. And then also some medications can cause your blood pressure to drop. Sudden drops in blood pressure most commonly occur in someone who's standing after laying down or sitting. This kind of blood pressure drop is known as postural hypotension or else orthostatic hypotension. Postural hypotension is considered a failure of either the cardiovascular system or the nervous system to react appropriately to the sudden changes in the change in position. Normally when you stand up, some blood pools in your lower extremities. Uncorrected, this would cause your blood pressure to fall, but your body normally compensates by sending messages to your heart to beat faster and to your blood vessels to constrict. This offsets the drop in blood pressure. If this does not happen or happens too slowly, you'll experience postural hypotension. So if you do feel dizzy or lightheaded, you should sit down or lie down, at least for a few minutes, and then you can attempt to get up slowly again. If you do start to feel dizzy, you'll have to stay seated for a while. Make sure that you do have some type of a person or something to lean on to help support you, because we would not want you to fall. But many elderly people do experience this, and so safety is key, and making sure that you get up very slowly. Most doctors consider blood pressure too low when it causes symptoms, and some of the common symptoms that you might find are dizziness, fainting, feeling weak at times, confusion. You can have cold and clammy skin, or also blurry vision is one of the symptoms. You can have one or all of these, but most often low blood pressure does not cause any symptoms or any problems and does not need treatment. So your blood pressure often rises with different types of activity, exercise, stress, sleep interruptions. And I'd at this point in time like to talk about high blood pressure and some of the effects of that, as well as how you can work to bring your blood pressure down. Your blood pressure normally changes with these different types of activities, and most often a physician will want 3 consecutive high blood pressure readings of 140/90 or higher before they even diagnose a high blood pressure or hypertension. Up to the age of 45, most often, more men have high blood pressure than women. As you age, both of you start to even out, and then as of the age of 65, most women, more women will have high blood pressure than men. Also, blood pressure is greater in families at times. There is a genetic tendency. African Americans seem to be more sensitive to salt, and so they'll seem to, with diet, have higher blood pressures. If some people have more of a predisposition to gain weight, that's also a genetic factor that will cause you to have higher blood pressure readings. So all of those things need to be taken into account. Stress can make one's blood pressure spike, but there's no evidence that it causes high blood pressure as an ongoing condition. The one issue, though, with stress is that it also affects other risk factors for heart disease. So it may have an indirect connection on hypertension in that it may lead to unhealthy habits such as smoking, alcohol use, poor diet choices, and that all contributes to high blood pressure also. Another contributing factor to blood pressure is drinking too much alcohol. It can increase your blood pressure. Guidelines from the American Heart Association states that if you drink alcohol, you should limit the amount to no more than 2 drinks for a man and 1 drink for a woman. Now, it's been told before that I only have 1 drink, but it's a 24-ounce beer or some such thing. Actually, they also define the quantity of alcohol that can be consumed and considered 1 drink. So for a beer, it is 8 ounces, or excuse me, for a beer, it's 12 ounces. For a glass of wine, it's 4 ounces. And for alcohol, 100 proof, it is 1 ounce. So being overweight places a strain on the heart and increases your risk of high blood pressure. That's why diets to lower blood pressure are often also designed to control calories. They typically call for cutting fatty foods and added sugars while increasing fruits, fresh vegetables, lean protein, and fiber. Sometimes even losing 10 pounds can make a big difference with your blood pressure readings and help get it more under control. Again, sodium, I think most people know that sodium or salt can increase your blood pressure. Reducing sodium in the diet can also have a significant effect. Salt or sodium intake causes most people to retain fluids, and these fluids cause more of an issue to push and to circulate that through the bloodstream. It is not just added salt during cooking that affects the amount of sodium intake in your diet. As shown in this picture, 5% of the sodium is added while cooking that you would take in a day. 6% is added while eating it at the dinner table. 12% of a person's intake of sodium in one day is naturally found in most foods. But 77% of sodium is found in processed foods, such as canned soups, canned vegetables, processed meat, such as hot dogs and lunch meats. If you can avoid using these processed meats and lean more towards fresh meats as well as fresh fruits, vegetables, or frozen is another good choice for those. You can actually cut out about 77% of the sodium that is normally found in a person's diet. Another thing that affects blood pressure is medications. Cold and flu medications that contain decongestants are one of several of the classes of medications that can cause increased blood pressure. Others include over-the-counter pain relievers. It might be steroid medications, diet pills, and often some antidepressants will also cause an increase in your blood pressure if you take those. If you have high blood pressure, it's very important to talk to your doctor about what medications you're taking. If they're herbal supplements or if there's even over-the-counter medications that you take on a more regular basis. If your physician is aware, they can adjust medications accordingly. It's important for you also to know that some of these things do affect your blood pressure. So, if you get jittery from drinking caffeine, can it also raise your blood pressure? Well, it might have a very temporary effect on your blood pressure, but studies haven't shown any link between caffeine and the development of hypertension. You can safely drink 1 to 2 8-ounce cups of caffeinated beverages a day, according to the American Heart Association. So lifestyle changes often will help, and when we talk about lifestyle changes, that is including diet and exercise changes to help decrease your blood pressure. Regular exercise helps lower blood pressure. Adults should get about 150 minutes worth of moderate intensity exercise every week. This includes things such as gardening, walking briskly, bicycling, or other aerobic exercises. Also, you should include some type of muscle strengthening twice a week, and this would include things that would work all major muscle groups in your body. Some complementary treatments also are meditation. This will help increase deep rest and lower your blood pressure. Others, yoga, tai chi, deep breathing, all will help with relaxation. This in combination with lifestyle changes such as diet and exercise will all contribute to a much healthier state. So many times, even by doing some of these lifestyle changes, or even as you're doing these lifestyle changes, there is a need for medication to be used within your regime to bring your blood pressure down to a safer level. So physicians will likely add medications to the plan of care when lifestyle changes are not enough to lower your blood pressure. There are many types of medications, and they all have different types of actions. So it's important that the physician prescribe exactly what is specific to your needs. Be aware, though, again, as a second time, herbal therapies or over-the-counter medications can affect some of the things that you will be taking with your for blood pressure. So it's very important that you inform your physician of anything that you're taking so that you're being treated appropriately for your condition. So controlling high blood pressure is serious business. High blood pressure is sometimes called a silent killer because it has no outward symptoms for years. In fact, 1 in 5 people with the condition don't even know they have high blood pressure. And if gone untreated or uncontrolled, it can quickly damage the heart, the lungs, the blood vessels, brain, kidneys, all the major organs. It's also considered a major risk factor when it comes to strokes and heart attacks in the United States. So hypertension is often a lifelong condition. It is something that you have to pay attention to once diagnosed. It's important to take your medications and continue to monitor your blood pressure. If you keep it under control, you can reduce the risk of some of these factors such as stroke, heart attack, kidney failure, and it would be very important for your lifestyle to continue to monitor the blood pressure and its state. Decreasing or stopping medications can be possible if you truly are successful with losing the extra weight and leading a more active lifestyle. It is a constant monitoring, but if you are able to successfully change the way you live and to improve your lifestyle, you will lead a long and healthy life. Thank you.